Hi, I'm Martha. I'm an occupational therapist. I work in home health, and today we're going to talk about breathing. It's slowly been getting sunnier where I parked, so I have more reflections in the glasses. We're going to talk about breathing. We're going to talk about two breathing techniques, but there are many. There are so many different breathing techniques that can accomplish different things. We're going to talk about the most popular one that most people have heard if they've been a patient, if they've been in rehab. Definitely if you have respiratory disease, useful for other things. So the first one is smell the flowers, blow out the candles. Does that sound familiar? This is a great breathing technique because we know what it does. We know that it is having these different things happening, relaxing your diaphragm, warm air over the amygdala, different things. End result, it lowers your blood pressure, your heart rate, and your breathing rate. Useful. You might be walking with a physical therapist and they're reminding you to do that, or anytime we see that you are out of breath. It is a great habit anytime you're out of breath. I'm going to say the downside is that people who are really sick and have shortness of breath all the time, they get tired of it. It feels boring. It feels like a lot of work. I'm watching somebody in this parking lot doing something it's like pretending to be an airplane, so I don't know what he's doing. I'm easily distracted like a 3-year-old, so put up with me. Yeah, people get tired of that, and some people worry about doing it right. Some people, and it's easy. It's easy, okay? And it takes practice to learn a breathing technique. I mean, you can do it while you're watching TV. It is something to get used to. It's new for you. And some of the things like inhale for a count of 8 and exhale on a count of 4, and those things take some practice. It's okay that it doesn't come naturally to you, but it is something that is worth practicing and pursuing. That breathing, that pursed lip breathing that does these things, it is canceling the fight or flight response. So good for anxiety, good for pain. Pain triggers the fight or flight response. We think it takes a bear in the woods, something very dramatic to trigger the fight or flight response. But if you get a phone call at 2 a.m. and someone in traffic is nearly running you over, where you kind of, pearl clutching moment. So that's the reason. Always start with a few of them. If you are starting to get kind of flustered, trying to get out of the house to the car, if you're in the middle of something and it's kind of, just slow down for a minute. Let's do a couple, okay? It takes a minute. That wasn't even 5. Do you feel things slowing down? Hopefully the last one was a little bit easier and more relaxing than the first one as you got into the rhythm of it. But here's the breathing technique that I use in my life all the time, and I do teach it with patients. It doesn't have the same research behind it that I know of, but my respiratory patients, COPD and such, they tell me that they tend to take slower, deeper breaths when they're doing this. I use this technique when I'm doing pain management, mindfulness techniques for pain management. You just breathe however you want. There are no rules about it. Just get comfortable and breathe. Give you a minute. Settle in. If you're comfortable closing your eyes, you can close your eyes. You're going to count each breath in and out in cycles of 4. That's it. And then you go back to 1. You might not even get to 4. Thoughts can interrupt you. Pain can interrupt you. You're just going back to 1. That's what mindfulness is. You are being mindful of the breathing. You are focusing on the feel of the breath. Your body, some people move here, some people down here. The body going in and out. The sound. Maybe the sound of the counting in your mind. You're giving your brain all these jobs to do so that it is focusing where you tell it to instead of wherever it wants to go. Okay. So we use this for pain management because your it's a conversation for another day. Nervous system can go crazy, fire too much about the pain signals, and we want the brain to ignore the pain signals and to do what we want it to do. Okay? And if you give your brain all these jobs, that's what it's going to do. And this takes practice too. So you might never get to 4, and it might be 1, 2, 1, 1, 2, 3, 1. When you are repeatedly returning to 1, it's almost like a kind of self-hypnosis. I'm not saying you are hypnotizing yourself, but if you are watching a scary movie and you don't hear people come into the house, if you are really lost in a good book, if you are the last people in the restaurant and you have no idea, that is an altered state of consciousness, right? That is a hyper focus. And so we're trying to create that with this. So let's just give it a go. We're just breathing, okay? I'll count. I tend to count on the exhale. Okay. It takes some time to get through them as you're slowing down. I've been doing it a long time, so my breaths get deep and slow. That's all you're doing. You're breathing. No rules. You're not counting how long it takes you to inhale. Each breath is a count of 1. And it doesn't matter if you never get higher than a count of 2. Just breathing. And we can talk about all the ways to apply it in another video. Right now, we're just breathing because I had a patient ask if it was online. So I'm putting it online. All right.